Hi everyone, I'm Suzanne Cairns from Bayside Family Dentistry. I'm here to offer some help for the community during isolation in how to look after your braces from home, what constitutes an emergency, when to call the dentist, and what you can do at home to manage it yourself. So let's start with some advice. Basics is just to keep the mouth really clean. With your braces on, cleaning is obviously going to be a bit more tricky, a bit more demanding. Yes, I'm going to give you some tips. Get yourself a good, decent toothbrush. It doesn't have to be electric. Manual is just as good. Brushing technique is really only as good as the person holding the brush. Here's a little model. Literally just brush at a 45-degree angle, no scrubbing, soft circular motions all the way around, getting right on top of the brackets. As you can see there, this is a good collection point for food. Obviously don't forget to do the bottom and the inside. Again, 45 degrees. Guys, take the time, do spend 2 minutes, a full 2 minutes on brushing. It's amazing how quickly you think 2 minutes it is, but it's actually only been about 20 seconds. After brushing, you want to get a little interproximal brush. These are a penny a dozen. You can get them at most supermarkets, pharmacies, and they're pretty reasonably priced, and you probably get a packet of 10 for a couple of bucks. Don't throw them out, obviously, as well after one go. Do reuse them. So after you're brushing, you want to get your interproximal brush and go in through the contact point between the teeth. This is a big collecting point for food. Take it out, give it a rinse, and keep going all the way around. Okay, brilliant. Cleaning done. Eat well, drink well. Eating a balanced diet. You've heard it all before from people on TV and specialists, whatnot. Eat well, fruit and veg, sugars. We're all human. We like a little treat every now and again. Keep the sugars to a low frequency. You know, if you're not going to a party, I suppose, with isolation, but if you have a snack, do rinse your mouth with water if you have a sugary snack afterwards. Avoid sugary drinks. People, it's just guaranteed dental treatment for the rest of your life if you drink sugary drinks. If you have any kind of food, any meals, rinse with water afterwards, and that will remove a lot of the bulk of the food and plaque off your braces during the day if you haven't got a chance to brush. All right. Just one more thing there. Habits. If you have braces on, obviously, don't chew your fingernails, don't chew pens. These things will certainly help to shatter brackets off the facing of the teeth, and will help to loosen wires, like so. Okay. All right, that brings me to what kind of issues can go wrong or things can pop up with braces. And this is the first one here, is a loose wire. It's popped out of the little tube at the back of the back tooth. Very common in the early stages of braces. As you go along through the different wires, they get thicker and stronger, and this does not happen during the later wires. If it does pop out and you want to have it a go to pop it back in again, you can literally just pop it through there's a little tube back there, and in it goes. If you can't manage it, lie down on the sofa, get someone to use your iPhone light, and get mum or dad to pop it in for you. If you cannot get it through the back there tube, guys, don't fret. If the wire's bouncing around like so and it's not annoying the flesh, you can leave it until we're all back to normal. Or some patients have been quite brave and have just snipped it here. They've snipped it there so they don't have the bouncing around the wire. Okay, if that's the case, you will have a short wire, and it will be a freshly cut wire, which can then irritate. You can also add a bit of orthodontic wax. Again, you can get this in the chemist and the supermarkets, very cheap. You can roll a little portion of the wax up and add it to the any rough surface or sharp surface in the mouth that has a little cut wire or a loose bracket or anything that's rubbing the flesh. The orthodontic wax is great for that. If you can't get a hold of orthodontic wax, you can use chewing gum, chewed up gum. You plonk it on there. It doesn't look very nice if it's at the front of the mouth, but it will certainly help to alleviate the catching of the wire against the flesh. Fabulous. Another small issue that could pop up is we have these elastic bands around the brackets. These are actually holding the wire against the tooth. They will fatigue after 4 weeks of wear in the mouth, and likely you'll see them ping off, or you might not even notice them ping off, they'll just be missing. These are not a big deal, guys. No stress. If you see 1 or 2 missing and the wire's still intact, that's fine. It's very, very unlikely that you'll lose the whole lot of them. I've never seen that at all happen when patients don't come back for treatment or they've moved house, and yes, so that's very, very unlikely to happen. So there you go. Like I say, any wires that have been sticking up in the mouth, and we don't know how long this isolation is going to go on for. You will not be shouted at by your dentist and orthodontist if you cut the wire yourself, if it is irritating you. You might get a wee ulcer, with something rubbing, constantly rubbing. You can manage that with some salty water a couple of times a day until the ulcer dies down. Like I say, you can use the orthodontic wax. Another good medication is Sabacol mouthwash. This is what we use at the practice. It's a chlorhexidine based, it's an antiseptic base, and it's really good to keeping the mouth clean. It's good for the whole family, for sores, sore gums, bleeding gums, and ulcers as well. So this is a good one to get as well if you want to get rid of any ulcers. So those are just a few of the small issues that I can think of that might arise during isolation if you have braces, metal braces this is on. Feel free to ask me any questions by emailing me at the practice info@baysidefamilydentistry.com.au or in the comments below. I can certainly help answer some of your queries. I'll be doing another little movie on other dental problems that might come up during isolation. Feel free to contact me for anything you want me to discuss in future, guys, as well. That's it really from me. So until next time, stay safe, keep well, brush your teeth. See you soon.